Hello, my name is Sean Bennett. I'm a DBH, and I'm here today to speak to you about a common condition known as preeclampsia. And while it's common, and we'll talk a little bit about statistics in a few, it's something that we can target to reduce the negative health outcomes faced by both the expectant mother and her unborn child. Knowing, they say, is half the battle. Yet, even though the vast majority of people, 83%, know that, and they've heard of, I should say, preeclampsia, 99% know that the preeclampsia is a serious or life-threatening condition for mothers and baby. 88% knew high blood pressure is a sign of preeclampsia, and 96% would call their doctor or midwife if they experienced a negative symptom. Well, that's the good news. But on the other side, despite all of that, more than half of respondents did not associate many of the known symptoms with preeclampsia. Other important aspects include 44% did not know that preeclampsia can occur up to 6 weeks after the delivery, and 46% did not know that women with preeclampsia are at higher risk for future health concerns. So that leads us to our first of the 1, 2, 3, and that is get to know the risk, get educated on the facts, ideally prior to deciding to become pregnant. We know at times that that's impractical, if not impossible, for several reasons. But getting up to speed is never too late. We're going to talk about a few of them here. We know the advanced maternal age, and the advanced in this term means women who are 40 plus are at greater risk. Those with multiple gestation and carrying multiple fetuses are also tend to be at greater risk as well. We know, unfortunately, that being African American places one at a disproportionate risk vis-a-vis their white counterparts when it comes to developing this condition. Also, family history is a marker for having those develop this condition. We know finally that among women who have had preeclampsia before, non-white women are much more likely than white women to develop preeclampsia again in a later pregnancy. So this is really important as we look a little bit at some of the signs and symptoms. We know that preeclampsia attacks and affects the vital organs, including the liver and kidneys, that it increases blood pressure. That's one of the key signs. That it also increases water retention. And so these are objective, measurable things that can be seen on tests or that can be measured by your physician. In terms of the symptoms that patients often complain of, they include upper abdominal pain, decreased urine output, shortness of breath, changes in vision, sometimes blurred vision and spotty vision, severe headaches, and even vomiting and nausea. So when we put these together, the signs that we can measure, the symptoms that people complain of, then we know we may be looking at preeclampsia. So, as we mentioned earlier, unfortunately, blacks and other people of color at high risk, as shown by this graph, for developing this condition. Blacks and Hispanics in particular outpace whites for this condition and the general population. So it's something that we want to pay particular attention to as we engage our patients and try to establish a baseline for their risk. So as we move to number two, we see that as we talked about, what kind of risk, what kind of symptoms, what kinds of biomarkers people may come to us with, it's really important to include that as we assemble our team. We want those who are understanding, can have some sensitivity to what it is that you're going through. But you can decide as the mother, the expectant mother, you are, I like to use the analogy, you are the coach of this team. You assemble the players, or you are in the driver's seat, and you decide who's going to be in the passengers on your team. In any case, you want to make sure you're comfortable with the people on your team. I encourage you to consider a doula. I'll talk in the next slide a little bit more about that. Feel the agency to make changes should you need to. And don't forget about your own behavioral and emotional wellness. This is one of the most emotionally tumultuous times that a woman will experience. And so making sure that you're tracking that is real critical. And I'll talk about the role of the DBH as well. So, a few of the reasons why, not all, but just a few of the reasons why to consider a doula. Decreased risk of cesarean births has been shown to be associated with having a doula on your team. Increased likelihood of vaginal birth, kind of flip sides of the same coin. A reduction in the length of labor, and I would imagine most women would vote for that. A decreased risk of low 5-minute APGAR scores for your newborn baby, and even increased success with breastfeeding rates. So all positive reasons, among other things, to have a doula on the team. Now, what about the role of the DBH? DBH plays a unique role to help advocate for the patient, to help the patient advocate for themselves. There's a growing phenomenon known as medical gaslighting. I like to refer to this phenomenon as meta-splaining, and that oftentimes the woman's voice is diminished, not taken into account in terms of her full experience and what she has experienced and what's important to her based on her personal experience. I believe, and I often say that all of us, for sure, as patients, are the experts in our own body. And in this particular instance, women are the experts in their own bodies. And so it's really important that their voice be heard. And oftentimes the DBH is really critical in helping to do that. And because of the model and our approach to understanding mental health, behavioral health, well-being, that we could de-emphasize the use of medication unless necessary. Like aspirin, we'll talk about the benefits of aspirin. We can take the approach to utilize the 5 A's to help the patient stay on track with their plan should something come in conflict with that, helping to recalibrate and resize where the goals of that plan, which will leads us to number 3. Get smart. All right, we use SMART, the acronym, to help think about setting the goals to stay on track, right? To set specific goals, those that are measurable. And we obviously have certain specific goals when it comes to the healthcare. Make them measurable. We can do that, and we'll talk a little bit about some of the specific measures that we can include in that. Achievable. Now, they're going to be achieved with you and the help of your team, and they can be achieved. They are realistic because this is the most realistic experience that you will ever have. Birthing a child, carrying that child, and understanding the risk to you and your child and mitigating those risks and delivering a healthy baby. And then from a time perspective, obviously it can be broken down many ways, but you can also think about it as 1, 2, 3 trimesters, but also pay attention to after delivery as well. Now, just a few notes. This was a report done by the American College of Obstetricians and Gynecologists, and it's a full report that comes out with a lot of different recommendations. We just want to take a moment to look at a few of the ways in which you can see things that can be measured. Again, for women with a medical history of early onset preeclampsia, there's a suggestion to initiate the administration of daily low dose aspirin beginning in the late first trimester. Right. Another recommendation is close monitoring of women with gestational hypertension or preeclampsia without severe futures, with a serial assessment of maternal symptoms and fetal movement. That's recommended to be done daily. That serial measurements of blood pressure recommended to be done at least twice weekly, and the assessment of platelet counts and liver enzymes at least weekly. And then finally, for women with severe preeclampsia uh, and at less than 34 weeks of gestation with stable maternal and fetal condition, it's recommended that these women, because it's severe, have access to the best, most able facilities with adequate maternal and neonatal intensive care. But I encourage you to read the full report to get a better understanding of the breadth of the recommendations here. Now let's take a moment to look quickly at this video produced by the New England Journal of Medicine. Great. Yeah. So again, a really just a snapshot, but of a really interesting study. I encourage you to go and look at that entire study. So as we close out, again, we just want to reiterate the fact that preeclampsia um, is a condition that can also still affect women even after they give birth. So postpartum preeclampsia is a serious condition related to high blood pressure in women after having a baby. New moms can develop preeclampsia up to 6 weeks after the baby is born. We talked about some of the signs earlier, the same signs, obviously. So it's important to make sure that your plan covers not only the entire period of your pregnancy, but a few months afterwards as well. And then finally, I want to close with just to talk about again the role of the DBH and using an acronym, big ideas. With ideas being an acronym standing for interprofessional dynamic engagement, achieving success. As we work cooperatively with our partners, we want to make sure that we're inspired by the goals of the patient that we serve, that we use all innovative approaches at our disposal when we have new technology, new knowledge, and an integrative approach to work with all parties to ensure the highest possible outcomes for those we serve. And that's where we'd like to conclude our session today. I really encourage you to read over the references, look at the full reports of those that were referenced, and we hope to see you soon and continue working with you. Thank you for your time today.